There we go. Hi guys, how you doing? Looks like we're live here, so I just want to say hi to everybody. We have ran into some technical difficulties setting up, so we're good. We're live now, and welcome to this week's webinar about Lyme disease. There's a lot of talk about where it comes from, what it does, and how it can really affect somebody's life. And I mean, it's kind of an epidemic. And as you'll hear from our two other gurus, Bill, say hi, Bill, and then John here, they're going to help us figure out more, more about what Lyme disease does for you in a bad way. So, Bill, go ahead. Let's. As far as Lyme disease, where does it come from, or is that something you want me to ask John?
Dr. Cornell can tell you.
All right. So John, where does Lyme disease come from, and how does it affect the immune system? How is it bad for you?
First, well, Lyme disease, the name Lyme disease comes from a little area in Connecticut that was named Lyme, and they had a very high incidence of this condition. What it does, it causes rheumatoid arthritis, causes flu-like symptoms, breakout points, look like a little spider bite or a tiny, it's a very tiny tick. It doesn't come from the full-size tick normally. It's a mouse that carries this. Actually, it's called a white-footed mouse. And the condition, you get it from a rickettsia from this tick. So it's much like the rickettsia that comes from spotted mount, or from Colorado, the spotted tick disease that started down there years ago. And this one, it just affects your central nervous system. It can actually give you symptoms like Bell's palsy, where part of your face sags, like in a stroke. And it could cause rheumatoid arthritis that goes through your body, many flu-like symptoms. You've got your blood pressure is raised, your temperature is raised in your body while it's trying to fight this symptom off. They've been using amoxicillin in children and penicillin in adults in the past. There's another couple new drugs that they have out now that they've been fighting with. And those are drugs that are given to you daily for like 2 weeks, a couple times a day to actually fight this condition.
So I have a question for you. That sounds like it's a painful process. Everything, as far as going through the process of taking this medication. I mean, it sounds like there's a lot of experimental medications they're using, stuff that seems to be really bad for your body overall, on top of having Lyme disease. Am I on track here, or is that?
All drugs are detrimental to your body, and actually you want to detox and take drugs out of your body as soon as you can. I mean, I could go into details of how many people die a year from something as simple as aspirin. There's over 71,000 people that die from that, in different conditions, from ulceration of the stomach to other effects that it causes the body to go through. So any drug that they give you, penicillin, amoxicillin, doxycycline is one of the other ones that they're trying now. And all these are very harmful to your body. We've found using hyperbaric chambers how effective oxygen is in the use of fighting this rickettsia tick-borne disease that affects the body. And mainly because the oxygen fights inflammation in your body, which is the main cause of pain when you have arthritis or knee joint problems or back problems, neck problems, and so forth. This oxygen helps fight that. They've known that for years. There was burn victims. They found that their tissue heals twice as fast. And by going into a hyperbaric chamber. So that's part of the reason why we're into hyperbaric.
Well, let me ask Bill a question here. So, Bill, at the beginning of this webinar, I said Lyme disease seems like it's an epidemic, and the person who told me that was Bill. So, Bill, why is it an epidemic? Why is it an epidemic, and what are we doing to? What are you doing to treat it?
Well, I think there's several reasons. First of all, we operate a chain of hyperbaric clinics, and so we're treating people all day long with a wide variety of health issues. But the other thing is we sell hyperbaric chambers all over the world. And right now, we're probably getting a minimum of 10 phone calls a week from people that want to buy a hyperbaric chamber because they have Lyme disease. So why all of a sudden is it so popular? Well, one of the reasons is it's been misdiagnosed for years and years and years. So many people that I talk to say they've had it for 10 years. They've had it for 20 years. They've had it for 30 years. So these people for years and years and years have lived with chronic fatigue and pain. And it was diagnosed as a whole bunch of other conditions, but now people are finally realizing it's being diagnosed for what it is. So I just got a letter a couple of weeks ago from a lady in Texas who had bought a hyperbaric chamber. Her husband actually bought it for her a couple months ago. And she sent me a letter and said, I've had Lyme disease for over 11 years, and I had forgotten what it felt like to feel good until I got the hyperbaric chamber. I talked to her after that, but she was so appreciative of having a life back that she thought she lost forever. And I talked to her after that, and she says, the sad thing is that I've had Lyme disease for 11 years. If I had known about the hyperbaric chamber 11 years ago, I wouldn't have lost 11 years of my life. The time and energy I would have had to spend with my kids that I lost. And the thing is that story is being repeated time after time after time all over the United States. But now, number one, people are realizing the condition that they have truly as Lyme disease. And number two, they're realizing there's something out there that can help them. We're not saying that the hyperbaric chamber is the only thing they should do, but it's something they should do. Add it to everything else that you're doing. Because, as the doctor said, oxygen kills the Lyme bacteria. So, therein lies the controversy.
Wow, so you're saying people are actually getting their lives back?
Many people.
Completely. And
that's why we're getting 10 phone calls a week. If it wasn't working, word wouldn't be spreading. But therein lies the controversy, because there are many doctors out there that represent that you have to treat Lyme at 2.4 ATA to kill the Lyme bacteria. Well, the majority of people in the United States are not going to put a chamber in their home that can go up to 2.4 ATA. For most, it's unaffordable. So the chambers that are generally available to the public only go up to 1.3 ATA. The question is, will that kill the Lyme bacteria? And we have studies that show that it has proven to kill the Lyme bacteria, which we'd be glad to share with people if they give us a call.
Awesome. And Bill did provide me with some of that information. So anyone who is or has an interest and watches this webinar, either live or after, definitely get a hold of me or we can get you, at the end of the webinar, we'll get you emails and contact information to get that information out to you guys. So I have another question for you, Bill. With these chambers, you kind of mentioned about the bigger chambers. Now, what's the difference between a hard chamber, as you called it, or the 2.4 bigger ATA chambers versus the smaller, or the soft chambers, as they're called?
Well, basically, the hard chambers will go to higher pressures. That's what you typically find in your hospitals and many commercial clinics throughout the U.S. So our instincts say, okay, if oxygen under pressure is good, more oxygen under more pressure must be better. But actually, in many cases, the body puts a wall of resistance up against the higher pressure, whereas it is absorbed by the lower pressure. Now, there's obvious exceptions to both. For example, a traumatic brain injury. The first 2 days after a traumatic brain injury, higher pressure is better. After that, it doesn't work. That's why all your studies have been done at around 1.5 ATA. But the question here is, will the chamber in my home at 1.3 ATA help my Lyme disease? That's the question. And it is proving that it does help the Lyme bacteria. Now, the challenge is that these bacteria have the ability to go dormant, bore themselves in the tissue and go dormant. Just when you think you've got your Lyme taken care of, they pop their heads up again. And that's why you have to keep using it, and then when they pop their head up, you whack it with the oxygen and along with everything else that you're using. And over a period of time, you finally start getting it under control.
Okay, well, I have a couple questions for you. If it's something that you can't answer, then maybe we'll swap over to John here and see if he can answer. Now, this webinar is mainly, about Lyme disease and also what hyperbaric therapy can do for Lyme disease. But we also want to get into what a little more about Lyme disease, so everybody, if people have a question, they'll be able to get it here in our webinar. So Bill, what you were talking about them having the ability to go dormant. Help me, because I don't know. How? Do you know how they go dormant or why they go dormant?
Let's let Dr. Cornell.
Okay. So Dr. Cornell, can you answer that? Why they would be why the Lyme disease, they can go dormant. Why? Do you know why that is?
The condition, it's a spirochete, and it's different than a virus or a bacteria. But what happens is it goes into remission because your immune system, and building up your immune system is one of the things that the hyperbaric chamber does by putting more oxygen into your system. And what it does is it gets it into control. Does it kill it off totally? No, not right away. It will over a period of time with a lot of oxygen. But what it does, it gets it under control, and that's what they say is dormant. All of a sudden, they have no symptoms. They have no more rheumatoid arthritis. They don't have any cardiopathic conditions with their heart. It doesn't affect the blood vascular system that all of a sudden they have an increased temperature, and all the other conditions that come along with Lyme disease have all of a sudden seem like they've gone dormant. They're still there.
Okay, so essentially, even if someone took medication and all the symptoms go away, it could still mean that there might be something in there. So
yeah.
So it could be. So that's not necessarily a surefire way to get rid of the virus then.
No, absolutely. And medications, all they do is lower your body's ability to lower your immune system from functioning at the aspect it should. And it's like someone was asking me years ago, what does this medication do or what does that medication do? The body will grow lazy. If something else is performing a function for it, the body thinks that it doesn't need to take care of it itself.
So it stops performing that.
It stops performing that function. The immune system is lowered, and then all of a sudden you're susceptible to everything else around.
So that actually brings me back to Bill here, because this is a hyperbaric chamber question. So with that being the answer, then it's probably wise to fill your body with oxygen, whereas instead of filling your body with medications. I mean, it's kind of a cut and dry question, but I mean,
The thing,
elaborate on that.
you know, here's the thing, is that people with Lyme disease want their life back. And there's no guarantee the hyperbaric chamber is going to help them. How much it helps them, nobody can guarantee. But the one thing, it's not going to hurt them. They have everything to win and nothing to lose. By filling your chamber with oxygen, it's doing a lot more than just fighting your Lyme disease. Like Dr. Cornell said, it's improving your immune system. It's detoxifying the vitamin. We could spend the next hour talking about all the benefits of hyperbaric therapy, but I think the best thing that we can do is, I'm sure if people are sitting here listening to this webinar, every time we answer questions, 5 more questions pop into their mind. And the best thing they can do is give us a call and ask us these questions, and we'll give them the answer. So our job is not to sit here and be a salesman. Our job is to educate the people about hyperbaric therapy so that they can make an intelligent decision as to whether this is something that could possibly help them fit within their protocol, add to what they're doing, or replace what they're doing. So our job is to educate the people, and I would encourage people to pick the phone up, give us a call.
Yeah, and I mean, I agree with you completely on that. It's I'm excited to be doing these webinars with Bill and John here, because it gives me an opportunity to learn more as I'm asking the gurus here, questions. I mean, as far as Lyme disease, we want, my goal and everybody else's goal here is to educate, and we want to make sure that the information we're getting out to you in the webinar here is some questions, that the major questions you may have about Lyme disease, about hyperbaric therapy, about treatments of it, about other treatments, but how they respond to your body, things like that. And that's why we're coming with these questions that we have. So, Dr. Cornell.
Yes.
I got another question for you. When it comes to Lyme disease, what would you say? Number one, we talked a little bit in the beginning about where it comes from. Now, how can people avoid, or help not get Lyme disease? Is there a way? Going out in the bushes, things like that. Should they be wearing tick repellent, things like that? I mean, it seems like a given, but some people don't know, and I don't know. I don't know too much. So.
Well, mainly the areas that this little tick affects is on your body, around your neck, your hairline, and also the upper body extremity, the hands, any part of your body that's not covered. So if you're going to be outside around an area that has these ticks, keep your body as well covered as possible. and then have somebody look you over closely when you come back in from the outdoors to make sure you don't have any of these ticks on you. And remember, they're smaller than the ticks that are on moose, elk, deer, bear, and so forth. They're a little bit smaller tick. It's harder to spot, so you have to look. And then the first thing that you would notice, if it's treated right away, your success of getting rid of the rickettsia is much more effective. So when you find a little, like what you think might be a spider bite or a mosquito bite on your skin, where you had already wiped off a tick, then you might be checked right away. It'll start swelling around that area, and then if that's the sign that you've been bitten by this tick with this spirochete.
Okay.
So I have a question.
Okay.
Change the camera.
If for Dr. Cornell,
Okay, I'll get us all in here.
if you get bit by a tick, you automatically get Lyme disease.
Not necessarily.
So if your immune system is strong enough to fight it off, or just because you get bit by this tick, are you automatically going to get Lyme disease?
So if your immune system has the antibodies that it's trying to put out normally, I mean, when you, let's go like a flu-like symptom, which some of the tick-borne diseases start out like a flu-like symptom, from Rocky Mountain spotted fever, for example. That's another tick-borne disease. These conditions, if your body is healthy enough and your immune system can respond right away, it'll fight this rickettsia off after you've been injected by the tick.
Okay. So in other words, if you keep your immune system up, your chances of not getting Lyme disease is a lot higher.
Yes.
Increased a lot. So that, I guess that would fall back to the hyperbaric chamber, because that's what they're known for, isn't it?
Prevention.
For increasing your immunity, helping increase oxygen to your immune system. Correct me if I'm wrong.
Yeah, it's important that we learn how to be proactive instead of reactive. And obviously, the hyperbaric chamber helps you do that. We live in a reactive society. We wait until we get sick before we do something about it. But it was just a question that I had. I'm not trying to sit here and promote being, if our immune system, why do some people get it and others don't? If 4 people go out and do something and one of them comes down with Lyme disease, why, and they're all in the same area, you know? So it was just a question.
It's an interesting. Excuse me. It's interesting. I guess it comes down to, if their immune system stronger. I guess where the person is. That's a question that I couldn't answer. So
The one thing we can do is, if people give us a call, we can sit here and share our successes and failures when it comes to the health issues that they have questions about. We can sit here and tell them what the hyperbaric chamber can do, but just as important, we can tell them what it can't do. And we also can share with them what hyperbaric chambers are best for them and which ones should they probably stay away from. So I'm sure our phone number is available on this website. Give us a call. Anytime, we'll be glad to help them out.
So I had another question for you, because that brought up an interesting question for me. Backing up just a little bit, when we're talking about the hyperbaric chambers, there's a big misconception, at least from what I've read and heard, that people promote it as a cure-all. And from what I've learned, because I was a hyperbaric patient myself, it's not necessarily that it's a cure-all. It's that it helps fix things that, because it fills your body with oxygen, that they weren't planning on getting fixed. I mean, am I on the right path with that, or?
Yeah, it's not just gonna treat the health issue you're trying to treat, it's gonna help everything, but it's a process, you know. It takes you a long time to get sick, it's gonna take you a long time to get back to where you were. Don't get into chamber and think next week you're gonna be back to normal.
Okay.
How long did it take you?
And that's why I was asking that question. There was problems in my body, like my legs, my knees, and all this stuff, and I felt like I'm getting better.
That's called old age.
Yeah, it's arthritis. Maybe I have Lyme disease. I don't know, but what? But I noticed with my knees and elbows and all these joints that were hurting, I was feeling better and better. Ligaments, just all these things are feeling better and better. And I'm sitting here thinking, wow, this machine is amazing. It's curing everything. But in reality, it's not that it's curing everything. It was just getting oxygen to areas of my body that didn't have oxygen before. And that was an interesting question for me. So to get towards, to kind of wrap it up here, because we're getting close to the end of our webinar, I wanted to make sure that if anybody has any questions, feel free to email us. Email me, email Bill, John. We'd love to talk to you guys. This is why we're here. We want to talk to every single person and inform you as much as we can about what we know about it. And
I'd rather they just pick the phone up and call.
Yeah, exactly. And that was going to be my next point. We can have, we got a couple different numbers here. And what's the first number, Bill, that they can call to get a hold of you for chamber cells?
My
all that stuff?
My phone is with me 24 hours a day, 7 days a week. My number 253-363-0500. Call it at any time.
And this is no pressure. This isn't like a sales call or anything. If they have questions, they want to talk to you.
Their questions.
Okay, and then so John, you're over here on the clinic side, also on the chamber side. If people wanted to get a hold of you, what number should they be using to call you?
253-549-1271.
You guys are lucky because that's their direct number, so you can talk with them directly. If you also want to get a hold of me, my number is 206-794-8229, and I would be more than happy to talk to anyone, anybody who wants to call and ask me questions. And if we want to get in a conference with Bill or John too, we can do that. So to wrap it up, any closing remarks you want to
make? The other thing I just want to say is that your call doesn't have to be related to Lyme disease, because we all know people that have cancer or stroke or autism, MS. If you have any health issues at all and you wonder if hyperbaric therapy will help it, give us a call.
Awesome. So, John, now I always like to, at the end of our webinar, I like to kind of throw in there. Last time stroke, we asked some questions. How can you, we asked a couple of questions on preventative maintenance. Now, is there anything else that people, like, you think people may be able to do or may not do that you'd recommend? Not saying you're the expert in the field, but from what you've seen, is there anything else you'd recommend over what you said?
We're talking about Lyme.
Yeah.
Well, other than covering yourself real well, keeping your body as healthy as possible, and that's one of the things that hyperbaric chambers do, is it keeps you healthy, keeps your immune system up at peak, so it'll prevent strokes, heart problems, arthritis, you name it. We've had people coming in with dementia and Alzheimer's that have really recovered closely, that they don't think themselves they've responded that well, but their caretakers around them or relatives say, yes. We've noticed that they've had longer conversations, they've been able to keep on task, their focus is better, and remembering things. So there's a lot of conditions that are easily affected by being proactive and keeping your body healthy.
Okay. So let me check here, and just before we get done here, there's a couple of questions that were asked to us. So one question for either Dr. Cornell or Bill was if somebody is already advanced in Lyme disease, what can the hyperbaric chamber still help if someone's already advanced along in Lyme disease? Because I'm not too familiar with this. So, like, is there different stages, or is that a question for Dr. Cornell?
It's a great question that somebody would ask. Excuse me. And earlier, Bill answered that about the gal that had Lyme disease for 11 years. All of a sudden, her body started functioning properly again, and she felt like she should feel at her age. So, yes, it's if you keep your body oxygenated, get the blood flowing properly. Angiogenesis is one of the things, building new blood vessels in the body, that happens with an oxygenated body. So yes, there is things that will help you years after you've had Lyme disease. It's not just something, as soon as you get Lyme disease, hop in a hyperbaric chamber. We're hoping that you don't get Lyme disease in the first place. But if you've had it, you'll recover from it, and you'll start seeing a remission of the symptoms.
So forgive me for not saying your name. The guy's name was Joe, and he had the question. So to answer your question, I guess, Joe, is that it doesn't matter what stage or how far along it is, it can still be taken care of in the hyperbaric chamber. So that looks like that's all we got for time here. And anything else anybody wanted to add, or if not, we're going to call it a night, and we'll see you guys next week. Stay tuned. We're going to release all the awesome information. If you want to give us a call, we're going to have some pretty awesome deals going on. It looks like over at the H3 side for treatments for to celebrate the Black Friday and things like that. So keep an eye out on our website, on our Google Plus, also on our Facebook, and we'll see you next time. And then I think we're going to release what our next topic is tomorrow for next Tuesday. So, all right, guys, we'll see you later, and have a great night, and stay safe out there.